Hi, I'm Dr. Savage. You're wondering how reliable is HIV testing? There are a couple of common ways to be screened for HIV, and that's what we're talking about here. The conventional intravenous blood sample HIV antibody test is fairly accurate. Studies have shown it's approximately 99.5% sensitive for diagnosing HIV. That means that 1 out of every 200 people that test positive with this test actually don't have HIV. So it's not perfect, it's not 100%. Recently, a lot of testing centers have taken to the more rapid testing where you could actually find out the same day the results of your test. That is slightly less sensitive. It's about 99%. That means about 1 out of every 100 people who test positive actually don't have HIV. So if there's any question regarding the test, the next step to do is to be retested. And if it's a rapid test, of course, then we would go to the more sensitive test, the IV blood sample test. Once that actually is screened to be positive, there are further tests to do, but at that point, it's still not 100%. That's something that you would also take up with your primary care physician or healthcare provider when you're there at the doctor's office or at the testing center. I trust this has been informative to you. I'm Dr. Savage. Here's to your health.